Sandpoint is a growing, vibrant city. It's expanding. There's lots of great opportunities, lots of walking, lots of physical activity. One of the things that they don't have is good access to healthy food.
Food insecurity is a real issue here, and access to healthy food, affordable food, is a real issue for a lot of the underserved populations in our community.
We have really high rates of obesity, childhood obesity in particular. We have high rates of heart disease, diabetes. We have low incidence of access to physicians, particularly family practice physicians, so we're considered a health shortage area. And in addition, it's very difficult for people to get to healthy food.
When National WIC Association brought this opportunity, I jumped at it. I thought, you know what, Bonner County could really use this grant. Obesity trends, as we know, not only nationally, but locally, have been going up. And because it is a health professional shortage area, and it's very rural, I thought that they would benefit from this grant, and Bonner County is the perfect place, and wanted to improve their access to healthy foods and beverages, as well as awareness to chronic disease prevention and treatment programs.
The solution to the needs assessment data and the high incidence of obesity in our county has been to form a coalition. And so this is a coalition made up of a diverse sector from our community. There's at least 90 members now on our coalition, and they come from different areas. We have city planners, we have physicians, we have WIC participants, we have community members. And as a result of that, we've come up with 4 distinct programs.
As part of the WIC program, we wanted to have more school gardens and more community gardens.
We have all this huge open land on all these school properties, the majority of which just goes unused. It's just grass, and that does nothing for our community. And so taking small portions of these properties and allowing people to go in and to grow crops, particularly their children in school, will start to create a lifestyle and a new just a new upbringing of drive to grow produce and fresh foods here in our community.
When we first put in the beds at the food bank in Early Head Start, people were like, oh, you know, we really don't know what to do. We're not gardeners, so we've got it so that it's really easy and self-sustaining.
Mountain State's Early Head Start and WIC serve the same population. We both serve pregnant women and breastfeeding women, and we serve families up to age 3. I heard about the Bonner County Coalition for Health through one of my staff. She had attended with a friend and came back and said, this is something we need to be involved in. We have the same goals for providing healthy foods for our families and people in the community, and supports nutrition.
Early nutrition is so important, not only for the child's health, but also for the mother's health. Being able to breastfeed reduces the incidence of disease states for the mother and helps her bond with her baby. And I think it's just an important first step in terms of adequate and healthy nutrition.
We have regular play groups every week, and the children get to come to the center and go out in the garden and gather some things that they want to take home. And we just had to do a big harvest of the radishes and chard last week, and so we harvested that and took it to the food bank.
We service 900 families within the county, and the majority of them are women and children. Because of WIC and the funding, we were able to create a community garden and provide fresh produce for those families. We've harvested 60 pounds so far. We've had it a month, and things are going well.
One of our programs is called the Change for Change program, and that's being run through the grocery store. Clients are able to go to the store, get a healthy recipe. As a result of looking at that recipe, there's 4 items that are on sale. They can go pick out those items that are on sale. They're all discounted at 10% or more. And then they can try the recipe at home and see how they like it. They get $1 off every time they buy one of the items. If they buy all 4 items, they get $5 off. And then they can hopefully come back and purchase more healthy foods.
That is a very innovative idea, to bring people into the store to get healthy foods and beverages, and also have some sort of monetary value to that. That is one of the first we've seen.
The Change for Change program is the project that I particularly participated in, and that was specifically increasing people's awareness to eat more healthy and how easy it is by promoting healthy recipes and incorporating new foods that they wouldn't normally be using. So they're actually hugely successful. I couldn't believe how many people we were able to impact.
We have another program that's called the Healthy Lifestyle Prescription, and we have now 8 different physician practices that are using these prescription pads.
We started this healthy lifestyle prescription pad as a way to get in touch with our patients, talking about some of the non-pharmaceutical options that they can use to help improve their health and overall well-being.
Prescription pad is specifically to encourage healthy living habits for their overall health, like exercise and eating well. And the Change for Change program, events like this, JC's Race, stopping smoking, and then the prescription pad refers them to a website, which is the bcch.us.
Promoting healthy eating and exercise is a big part of our pregnancy education that we provide, as well as just general health. The Healthy Lifestyle RX is a way to jump off into that and really get the pregnant mom some information on how to eat healthily and how to exercise more.
We have a program in Sandpoint called JC's Race, and it's to benefit other kids. And many physicians are telling their patients, I want you to train so that you can walk in this program.
I participated in JC's Race as a way to be a part of the community, and thinking about all these different community programs that are available has given me more information to pass on to the patients.
I do have some clients here today. One of them is a pregnant mom. She's delivering in a couple weeks. She had kind of had a pretty significant early on weight gain. We had talked about at our last appointment that she was going to work on walking in the evenings, and then she saw the JC's Race and decided that she would participate along with her 6-year-old.
Now I'm seeing that all these things are available, and a lot of patients just might not know that they're there. So we were able to really consolidate all of this information together, get it on the Healthy Lifestyle prescription, but also just give us a chance to learn as clinicians what the programs are, how do we get them to our patients, and how do we get them outdoors getting healthier.
The dream and the hope for these programs is that we actually do make a difference. So we'd like to have this be sustainable. We needed the Community Partnerships for Healthy Mothers and Children grant in order to make any of these wonderful projects happen. We're hoping these things continue to blossom and grow, and that it will continue to work together to improve the health of our county.